Hiya.
How you going?
Yeah, not bad.
Hi, Maisie.
Maisie.
Yeah.
Oh my gosh, she's huge, Nathan.
Maisie, hello, baby.
Gosh, she's beautiful, isn't she?
Thanks.
So, she's not walking right.
I think it's her back left leg. And
Okay.
She's just doesn't seem to want to put too much weight on it.
How long ago did that sort of start?
I would say probably about a week ago.
Okay.
I noticed it, and a bit more reluctant to go out for her walks, which isn't really like her.
You look quite nervous now.
Yeah, you do.
It's one of those things, you know, you deal with clients all the time, but then when you become the client,
And it's your dog.
it's very different.
Nathan is Mr. Cool, Calm and Collected. He's a very chilled out fella.
Come on, this way.
Rarely does he show his emotion, but today I can really see it in his face. His heart's on his sleeve and he's a very nervous boy.
Look at me.
Good girl. She does seem a little bit tender, even just touching her hip joint. Okay, so now I'm just going to try and extend it, mate. Okay. Oh, you're a strong girl, aren't you? Okay. Oh, let me just feel. That's it. Okay, all right. Okay. So just have a feel of this knee now. Good girl. So she's definitely tender in her left knee more than she is in that hip. Yeah, she really does not like that. And it does feel a little bit thickened, actually. Good girl, good girl, good girl, good girl. Extend that right out. Okay.
Maisie actually presents quite a number of challenges because she is so large. She's very big, so hard to sort of grab hold of everything you need to and manipulate it. So it does mean it's quite a challenge and we do need to make sure we keep our wits about us today.
It feels a little bit like nuts and bolts in this knee also. Not as thickened as the other side and not as painful as the other side. So
No.
I think your initial assessment of a left leg issue is absolutely right. So what we need to do is to give her a sedation to be able to examine her a little bit better while she's deprived of her senses. And then we'll do some x-rays and just see what's going on in all of these joints.
Oh.
Okay, mate.
Okay.
Assume your position. Okay.
I have to get on top of my dog.
Okay, I'll try not to miss, Nathan.
Mate, Scott's not got the best view at the moment, but I just hope he doesn't make that needle slip.
All right, you ready?
Yep.
Okay, oh.
Oh,
Here we
these
go.
are nice.
Here we go. Oh, brave girl, brave girl. There we go, well done.
All done?
Yep, all done. There we go.
Giant breed dogs are known to have a number of genetically predisposed conditions because they are so huge.
Oh.
Good girl.
But all that weight and pressure comes to bear on the joints and therefore they do tend to have more issues with their joints than a smaller dog would. So what we now need to do is to x-ray her. So we take a number of different images, starting with the knees and then moving to the hips.
X-ray.
Just to get a full picture of exactly what's going on with little Maisie or big Maisie.
So what do you want to know, the good news or the bad news?
Well, is that good news?
There is good news.
Yeah.
The good news is that her hips look fine,
Oh, wow.
which is really good. So they're sitting nicely into that hip joint there, nice and smooth. Her knees, however, are a concern. She's put more weight onto the left, twisted very quickly, and injured her cruciate ligament on the left. It's a very common injury of like football players or netball players, anyone that turns suddenly and stops. She's got serious inertia going on. Once she's moving, she's not going to stop quickly.
No.
So at some point, we need to give that stability back. And unfortunately, the only way that we can do that is with surgery. So I'm going to send you to a very good mate of mine, Michael Hamilton, the orthopedic surgeon, and he can have a look at Maisie and see what he needs to do.
Yeah. Now that I know what the problem is, I don't know what the next step is, what Michael's going to say about it. We just have to wait and see.
So some tough times ahead, unfortunately.
Oh, poor thing.
Are you climb, sweetie?
Across town, Scott's wife Zoe and daughter Quinn are on a special mission to collect the next patient.
Good job.
Let's go and feed the
Yeah, you can show me where they are, honey. So Scott gets a phone call from Quinn's school yesterday, and it turns out one of their chickens isn't too well. So I'm here to essentially be a sort of veterinary assistant and come and pick up the patient.
Hi, Mrs. Parr.
Hello!
Quinn, how are you?
Good.
Hi, Zoe.
Hi, Mrs.
Thank
Parr,
you
how are you?
I'm fine. Thank you so much for coming. We've been
no
really
problem.
worried about one of our chickens, as you know. Poor Jane, she's been losing a bit of weight and she's not eating properly. And we noticed that her wattle was getting filled up and not emptying by the next day. So that's why we phoned Scott. We were just hoping that we can make her better and sort out whatever's going wrong with her wattle. Sorry, here she is.
Well done, caught in
Here's
one.
Jane.
Hello, darling. Hello. Oh, my goodness, yes, you are a little inflated, to say the least.
I think she is. It must be terribly uncomfortable for her.
When did you notice that?
A couple of weeks ago, so we've tried giving her some oil to try and dislodge the food that's stuck there, but
Right.
it doesn't seem to have worked. So
Oh, dear.
that's why we've phoned Scott to hope that he can help us
Worry.
out.
Chicken man to the rescue.
Yeah.
I'm sure I'll be able to help her. Being the chicken expert that I am, having, been in the vicinity of the 4 we have at home, I'd say definitely a crop problem, full of stuff that it shouldn't be in there, and we need to get it out. There we are. That's my take on it.
Shall we take the chicken to Daddy then?
Yes.
Do you think Daddy's going to be able to sort Jane out to make her better?
My dad can sort any animal out.
Oh, he's got a super daddy, haven't you?
I'll get the box.
Oh, good
Thank
idea,
you, Quinn.
Wow, you guys are very organised.
Good
Well
girl.
done.
The chicken goes in here, then the blanket goes over her.
Okay.
Thank you, Quinn.
There we go.
Shall we put the blanket over there then?
Whoa!
I'll
Jane,
hold on to it. Put the
I'll
blanket.
do it. I'll help you, sweetheart, if you want. There we go.
There you go.
I see a little head popping out.
Let's check.
Yes, make her safe.
There we go. She's in. Great. The chicken rescuers. Let's go, Quinn.
Quinn, chicken rescuer.
Oh, well done.
This is a heavy chicken.
She's got a lot of extra weight with her.
Yes, she
Mrs. Parr, I'll
has.
speak to you later on.
Okay,
Thanks so much.
bye.
Coming in, Quinn. This way, honey.
Quinn is now going off to class, and Zoe will be heading in to see Scott.
It's all been quite easy, really. I drop one child off and pick up a chicken. Standard day, really.
La la, la la, la la, la la, la la. No one needs a sick chicken.
Come on, Rufus. There we go.
At the Richmond Practice, Sarah from the rescue organisation All Dogs Matter has brought in 2 very special cases to see Scott.
We've got Nelly, who's 5, and Rufus, who's about a year. They came from a puppy farm. They would never have been in a house, never walked on grass, never played, never had a name, which I think is probably the saddest thing. We're here to see Scott today for Rufus to be neutered and Nelly to be spayed and to have her teeth looked at, which are in a very poor condition.
It's likely Nelly, the older of the 2, was used as a breeding dog at the puppy farm.
Hello there, Sarah. How are you?
Hi, Scott.
So these are the new recruits.
They are.
Hello.
This is Nelly.
Hello, beautiful. You're very shy, aren't you?
She's very shy.
Oh, dear.
very shy.
And who's this little chap back here?
This is Rufus. He's a little bit of a baby, but
Hello,
he's
Rufus.
growing in confidence.
Yes, well, I suppose lots of the puppy farm dogs are pretty nervous. They haven't had much work on their basic training, have
That's
they?
right, that's right.
Well, let's get them in the consult room, shall we?
Okay.
It's very clear that Nelly and Rufus are traumatised. They're very nervous, very quiet, just little shadows of dogs.
So, how were they when you first picked them up?
Just terrified, stinky, terrified, wouldn't come out of the crate.
Oh, dear. You can just tell it's just so timid and
Yeah.
quiet because they've just not really had a life to this point. Life has just been being a mum, having puppies in
Constantly.
fairly squalid environments.
Yeah, constant puppies. Constant.
It's thought that as many as 1 in 3 puppies sold in the UK are bred in a puppy farm. And usually they're in squalid, filthy conditions with very little natural light. I really find puppy breeding at this level just abhorrent, and it really angers me. Obviously, she's had a bit of a groom, so she's looking a bit shinier and healthier, but
Yeah.
physically, I can smell that there might be an issue with her mouth. She's got fairly bad breath. Yeah.
neck. So they're really pretty disgusting teeth, and they're a huge amount of tartar build-up, which is likely because of years of very poor nutrition, just filling them full of whatever they can get hold of that's probably the cheapest. And the same, ew, yuck. Okay, and there's even a loose tooth there, look at that. That must actually hurt. Oh dear. Okay, well, we can sort that right out. That'll make you feel much better, won't it? Looking into Nelly's mouth, it's very clear that she's suffering with quite a degree of discomfort. It is just the personification of neglect. And the people running this farm didn't even have the decency to look after her general health. All right, let's have a listen.
It's okay.
All right. So it really does anger me when dogs are treated this way, but even worse is this poor girl has got a heart murmur, a fairly significant heart murmur. And one thing we know about Cavaliers is that they genetically inherit most of their heart defects. The heart murmur that Nelly has should have stopped with Nelly, but being used as a breeding bitch, probably 50% of her offspring have the heart murmur that they shouldn't have because Nelly never should have been bred in the first place. It's disgraceful.
So here's Rufus.
Hello, Rufus. Hello. Oh my goodness, you are so beautiful, aren't you? Hey, hello, mate. You're all right. You're safe here, don't you worry. You're a handsome boy, yes. Okay, so his teeth are lovely.
Yeah.
Not too bad at all. So that would suggest he's far younger.
Yeah.
He does look like he's probably only maybe a year or so. I think that's reasonable. Okay, I'm just going to have a little listen here. Good boy. So he's blessed with a healthy heart.
Yeah.
Examining little Rufus, I can see he is, besides nervous and shy and doesn't have many social skills, understandably, he is a relatively healthy chap. So I'm hopeful with just a castration, he'll be on the road to recovery very soon. Well, I'll take these two new recruits of yours off your hands for the day.
Lovely.
Yeah.
Perfect. Scott really has an understanding of puppy farm dogs and their needs because they are quite specific. They're very, very timid. They're having to learn everything for the first time. Look after them.
I will. And I'll give you a call once they're done.
Lovely, thank
All
you.
right. Bye, Sarah.
Bye.
Take care. Don't worry, she'll be back for you soon. Hello, ladies.
Oh, you're so cute.
Thank you. Oh, you mean the dog?
No, I wasn't talking about you.
Yeah. No, that's fair.
At the Richmond Clinic, it's surgery time for badly neglected King Charles Cavaliers, Nelly and Rufus.
And unfortunately, they are the unwanted from the puppy farm trade. Yeah, so both quite nervous, you can see quite shy. Today is day one of trying to improve these dogs' lives by at least giving them health. Certainly for Rufus, it's about neutering him. And for Nelly, it's about sorting out those horrendous teeth, checking out her heart, and of course, spaying her as well. All right.
Scott will perform Rufus's neutering first and is being assisted by nurses Sam and Alicia.
This is a very straightforward operation. It's one we do every day. But this boy has obviously been through a terrible life up to now, so it does make you sort of go, you know, I just want to protect you. So Liz and I have got an eagle eye on this boy, making sure he's okay. So Sam, I'll be coming through in a few minutes, just to start on Nelly, okay? Rufus is nearly done.
While Scott is working on Rufus, in the next room, Sam has started prepping Nelly.
Okay, so there's no more baby making for you, my boy. Now that Rufus' castration has been completed and he's recovering, I now move to Nelly. Now, she has a fairly significant heart murmur, but also she is an older girl. She's been through a lot, so this will be a little bit of a risky anaesthetic. She all okay, Sam?
Yeah, I'm good.
Yeah, so you can just see how massive this uterus is, which just suggests that it's been well and truly used and abused. Sam, how's she getting on? Heart sounds okay?
Mm-hmm.
Besides the murmur, of course.
Yeah.
All right, so spay done, dental next. Let's go.
Now, normally we wouldn't do a dental on the same day as a spay. It's not great to liberate all that bacteria that'll be present in her nasty mouth, but needs must. And she's a dog that could really do with just one anaesthetic and everything being sorted. It's disgusting. She's never had anyone looking out for her best interests or her welfare. This is the first time. So to see her mouth in the state that it's in, it's pretty horrifying. See how easy they come out and just fall out. It'll end up being there's more teeth in that bowl than there is in her mouth.
At least it won't be uncomfortable anymore.
Yeah, she'll be much more comfortable without them. Better out than in, I say.
Scott eventually has to remove 16 rotten teeth from the little spaniel.
Okay, that's it for that. Beautiful. After sorting out her teeth and removing those 16 rotten teeth, I now move on to assessing a heart defect. You're happy with everything still, Sam? She's okay?
Yeah.
Because we've worked out that Nelly does have a heart murmur, I want to look into that a little bit more. So I'm going to be performing a cardiac ultrasound just to understand what problems are going on in Nelly's heart. Just in the centre there, we've got a sort of flapping saloon door almost, which is the mitral valve, which is just a little bit thickened. So it's just not closing as well as it should. But the good news for little Nelly, the atrium is not significantly larger, which would suggest that it's not yet stretching because of this abnormality. So as yet, she doesn't need any medication. She just needs to be monitored. Okay, so let's wake this girl up, shall we? Although Nelly has got a heart murmur, it's not having any impact on her general health at the moment. Now, it will need monitoring in case it develops into heart disease sometime down the road, in which case we'll likely need medication or further diagnostic tests. But for now, she's all good.
Look who I've got.
Nelly and Rufus will remain at the practice overnight to recover from their surgeries.
There you go. You're a tough old bird, aren't you, eh? Yeah. It's really wonderful to have been a part of Nelly and Rufus's journey. They've come from horrendous backgrounds where they've just not been loved or treated very well at all. And I've managed to bring them to a point now where they are healthy and they are ready to find a new home filled with love. And let's hope they find it.
She's going to be okay. You're both going to be okay. Yeah, you're going to be just fine.
This way.
At the Cherry Tree practice, Scott's vet nurse Nathan has arrived with his Newfoundland Maisie to see specialist orthopedic surgeon Michael Hamilton.
We're here to see Michael for Maisie's leg. Hopefully there's something quite simple he can do. I'm really nervous about what's happening today. Having lost a previous dog anaesthetic, it's not something that I take lightly.
Hi, Nathan. All right.
Hi, Michael.
Good to see you. Good to see you. Right, Maisie. So, I believe we have a ruptured cruciate. Come in, we'll have a feel, and we'll get it sorted for you. So.
Excellent.
Right, Maisie, this way, darling. Let's go.
On. Up we go.
Righty. Okay. So, let's have a little feel. Ooh, she's got a big puffy knee on this left side. Let's have a quick feel up her leg. This is her knee. So, a little test that we do. Finger on the front of her shin. Hold her knee, pull up on her toes, and that finger moving forwards tells me that she has stretched or partially snapped her cruciate ligament. So there's your diagnosis right away. Whether it's completely snapped or not is irrelevant. That is an unstable knee. We call it the cranial cruciate ligament, and that's a ligament that kind of connects your tibia, your shin, to your femur and stops the bones kind of moving around all over the place. So in effect, what we do, the top of the shin bone is on a slope, and then when she walks, the femur rolls down the hill, we make it flat and put a big plate and screws on. Prognosis is really, really good.
Yeah.
So of all the things that she could have go wrong, this is probably not a bad one to go wrong. So, let's look on the bright side. Nathan's put on a very brave face. I can tell he's a little bit nervous. This is he's the guy kind of reassuring the owners most of the time, whereas now it's me trying to reassure him. So the girls are waiting for us, so we'll take her through, we'll get her asleep, do the surgery. You go off for a little walk or a drive or a beer or two or whatever.
Might be alcohol involved.
Yeah. And I'll give you a call as soon as she's done, and we'll get it back to you.
With any surgery, it always carries a degree of risk. I see the good things and I see the things when it doesn't quite go as planned, and that never leaves you. Although the operation's hard and I really don't like to see anyone operate on my dog, I know it's the right thing for her.
The time has arrived, so if you hand her over, I'll take her through and we'll get her sorted out for you. Right, Maisie, wakey, wakey. Cruciate repair time.
Maze, who's a good girl?
At the Isleworth practice, Zoe is arriving with the school chicken, and Scott and vet nurse Reagan are waiting.
Hello.
Hello, honey.
Hi. Hiya. I got a chicken in a box for you. Do you want to see it?
Yeah. Hello. Oh, hello, gorgeous.
Check her out, look. I got it right. It is definitely a chicken.
Does she have a name?
Jane.
Jane the chicken?
Jane the chicken, of course.
Jane. Oh.
She's beautiful, though, isn't her?
Do you know
Look
a
at
Jane?
her plumage.
I do know a Jane. My mum's called Jane.
This one's full of front. I don't know about your mother. I'm talking about this one.
Right. She's big up top.
Big up top.
Right.
Yeah.
Okay, well, it sounds like she needs some support, both physically and veterinarily.
Yeah,
that word.
Yeah.
So glad I brought it to you. Brilliant. Full of confidence. Should we go through the console?
Yes, let's go.
I can't believe here I am bringing chicks to see my husband, hey? But I know he'll be able to help this one. Feel that.
Let's have a little feel.
What a massive bag of, well, crop.
Oh my
that
word,
huge?
that is bizarre.
I know,
isn't
it's
it?
mad, huh?
My goodness, the crop that she has, that sort of storage area for food, is absolutely massive. It's a handful of grit. It's astounding. But within that, what you can feel is obviously food, because the crop is there to basically hold food before it goes further down the gastrointestinal tract. It's kind of like the larder cupboard of the chicken, really.
Okay.
But actually behind that, there's a thick, like, web of something. So this crop has become impacted with something. It's continued to fill, it's stretched, and now it's actually falling over her breastbone. And so it's just not emptying normally the way that it should. So what we need to do is actually X-ray and just see exactly what lies beneath. And if it's large enough, we're going to have to go in and perform surgery.
This chicken is going through something right now. It's uncomfortable for her, and she's about to go through an X-ray, most likely surgery.
Say bye.
So you can feel that element of pressure. You're like, the kids are waiting for this chicken to come back all well and fixed by Scott. So yeah, that's a bit of pressure for him there.
Hi, guys.
Hi.
Reagan and vet Tina will be assisting Scott.
What is that?
I know.
Hey?
Isn't that the most massive crop you've ever felt on a chicken in your entire life?
Very big. Let's check her weight. Here we go.
Can we weigh you,
That's really
sweetheart? Good girl. Okay, so at the moment, you're about 2.47 kilograms of chicken.
Come on, Jane. Let's go get some pictures.
Let's go and X-ray a chicken. Unfortunately, Jane's condition literally won't right itself. And already today, I can feel that her crop is warmer, so it's starting to ferment. That will make this girl really unwell. And if we don't do anything, it could eventually lead to her death. Okay, stay still, Jane. X-ray. As you can see, a lot of material. That's very likely to be grit, which is absolutely normal. But what you can't see on here is what I can feel in the crop of Jane. So it's a little bit like a block drain, I suppose, in that what we've got is this sort of thick mat of, feels like fibrous material. It could be hay, it could be grass. And that's meaning that the food isn't passing through, it's remaining in the crop. The crop is stretching, and then therefore food stays in there longer. It stretches more, so it's a little bit of a deteriorating cycle. So all of that needs to come out. Unfortunately, we do need to perform surgery. And the interesting thing is I think an anaesthetic is probably even more risky. So I think it's far better that we just try and do this while she's conscious. Birds don't do very well under anaesthetic. They're quite prone to stress. But also, unfortunately, with this particular condition, she could regurgitate during the surgery and then breathe that in, get aspiration pneumonia and die. So there's lots of major risks, and all of them can be reduced by performing the surgery conscious.
Does that mean a local anaesthetic then?
Yeah.
Luckily, she's quite a relaxed chicken, so hopefully
Yeah.
she'll sit quite still for you.
Yeah, she seems very good, doesn't she? Okay. Well, let's get to work. I'm just going to pluck this first. First, we have to pluck poor Jane's crop, and then I give her the local anaesthetic, which is going to sting a little bit. But she seems to be taking it in a stride. She seems quite calm and quite relaxed, but who knows how she's going to react when I start to cut. She's a little stressed.
I know.
Okay. Right. Everyone ready for this, because I don't know what's going to come out. I also don't know how she's going to respond, but it needs to be done. Everyone ready for this, because I don't know what's going to come out. I also don't know how she's going to respond, but it needs to be done. Okay, good girl.
In Isleworth, Scott, Tina and Nurse Reagan are about to perform unusual surgery on a conscious chicken.
Feels very strange to have my patient looking at me whilst I'm doing this sort of thing.
Hey, Jane.
Okay, guys, so I'm going to go into the crop now. So expect a really appalling smell.
Oh.
Jane has an impacted crop, so basically what I believe is that she's eaten something that she shouldn't, like long grass, that slowed down the transit of food down into her gastrointestinal tract, and it means that I need to go in and get it out. Oh, man, that's rancid.
Oh.
Look at all this stuff in here. Oh, my God. It's not nice. There we go. Here's the big thing. Wow. This is what I could feel. That is the problem right there. Oh, that is grim.
Jane, how are you still alive, my love?
How is she still alive? Look at that.
Oh my God.
Oh my God, it's still coming. Oh my God. Oh.
That's disgusting.
Oh, that smells. Oh, wow, that is rank.
All right, Jane.
Good girl. Jane's crop was full of really long grass, which has probably been building up over months, and it started to ferment, and it's giving off a gas, which leads to a really rancid stench. So if we can stop her access to that, then we might not have this issue come back.
I can't believe how amazing she's been.
Yeah. What I want to do now, Reagan, is just give it a bit of a flush, and then I'm going to start to close. Extraordinary.
She's actually watching.
That's off-putting. Yeah. The bizarre thing about performing a conscious surgery on an animal is that they can look at you while you're doing it. And Jane has her beady eyes literally set on me, and it does make her quiver a little bit because it's an incredibly gruesome surgery, but she's taking it like a trooper. She's amazing, isn't she? I don't think I'll ever look at a chicken the same way again.
No, she's very, very brave.
There we go. And that is our first conscious chicken crop impaction surgery.
Are you
done.
picking? Should we see how much she weighs quickly?
Yes, that's a great idea. Jane's pre-surgery weigh-in, she weighed 2.47 kilograms, but after removing a huge amount of muck from her crop, I'm really interested to see what she weighs now. Okay, the moment of truth. Yeah, all right, yeah, good girl.
Good girl.
So she's 2.235, so over 200 grams
Yeah.
of grossness
Of yuckiness.
removed from your crop, eh?
Now you look like a normal chicken again.
200 grams might not sound like a lot, but for a chicken like Jane, it's 10% of her body weight, which is massive, and it really will make a difference to her comfort levels now it's out. Here we go. There you go. All right. Yeah, you're going to feel so much better. Because Jane's crop was distended for so long, it's become very stretched and very baggy, and even after the surgery, that isn't going to improve. So I do need to find a way to help to manage that so that she never suffers with crop impaction again. Going to need to talk a little bit about support, aren't we, eh? Stop that crop from filling up like that again.
At the Cherry Tree Practice, Nurse Nathan's beloved Newfoundland Maisie is being prepared for surgery. to repair her ruptured cruciate ligament.
Oh, it's a big old leg, isn't it?
3-year-old Maisie weighs in at a massive 60 kilos, and for specialist Michael Hamilton and his team, surgery will be a challenge.
Right, so Kim, in here. Yeah. Hold. I mean, she was hanging off the end of the table. I mean, that's quite a big table, and the head was almost off that end. Her legs are dangling off this end, so it's quite hard for the assistants because they're kind of holding that leg of whatever it weighs, 15 kilos or whatever. So yeah, it's just quite hard work. Right, so first incision. The first part of the procedure is we get into the knee joint. We look at the cruciate, what's left of it. I don't know, probably 5% or less of the cruciate ligament left intact in here. So this has been grumbling on for a little while. What we've got to do now, though, we have to very, very critically check the meniscus, the shock absorber thing. So just pull that foot, Kim. Yeah. So this is quite a fiddly thing to do. So we use this little probe, and we look right off the back. So what we need to do is remove that damaged portion of the shock absorber, the meniscus. And there it is. This should be all nice and shiny. It's all crushed. And that whole thing was kind of flipping forward in the knee. So taking that out will make a huge difference.
With the torn fragment of the meniscus removed, Michael can now start stabilising Maisie's knee.
So this is the blade that we cut the bone with. You push this into the bone, which cuts along that curve. There we go, right, okay. This is the scary part because there's a big, big blood vessel just off the back of the tibia. And if we cut that, that's pretty stressful. It bleeds a lot. And it's full on, you know, you're cutting through the tibia of a 60-kilo dog. It's a pretty big deal. Kim's gonna flush like she's never flushed before. Right, ready, go.
Maisie's bones will now be held in their new, more stable position using a metal plate.
Right, so my favourite part is the power screwdriver. It kind of makes me feel like I work for McLaren or Ferrari or someone. So. So 1, 2, 3, 4 in the bottom, then there's the curvy cut, and then there's 4 on the top. So now it's just a question of closing them up and checking everything's in the right place.
Maisie's owner, Nathan, who's also Scott's vet nurse, has arrived, anxious to find out if the surgery has been a success.
I just want to take her home, give her lots of cuddles, and yeah, just make sure everything's okay.
Right, so the most important thing is, do we have any, what we call tibial thrust? So same test as before, finger on there, pull up on the toes, no movement whatsoever. So although there's no cruciate ligament in there, when she stands on the leg, the knee is stable, and that's the most important thing. This procedure, it's elective surgery. I mean, if you didn't do it, she wouldn't kind of keel over, but she'd have a sore knee for the rest of her day. So to get her back to as normal function as possible, hopefully this procedure is the way to go. Okay, right, come on through, Nathan. Here she is, right. So look who's here to see you. Maisie. Hello, darling. Look who's here.
Where's Maisie? Where's he gone?
Hello.
Hey?
You recognise him? She might just try and run straight out here. Hey, Maisie. I said, Daddy's here. Whoop. Come on, then. You stand up. You stand up. Oh, a little bit sleepy. A little bit sleepy.
I'm so happy to see Maisie. She's been for a big operation. Michael's done a great job. She's moving already. Yeah, couldn't be happier.
No, so everything went very well, and I have very high expectations for her, so over to you.
As Nathan is an experienced vet nurse, he can take Maisie home tonight to begin her rehabilitation.
It's a Maze. He's a good girl. He's a good girl, eh?
Morning, Jane. Hello, baby. Hello.
Good morning to you. Bright and happy, very talkative this morning. Come on then.
Next morning in Isleworth, Jane, the school chicken, has recovered well after the unusual procedure to clear a massive blockage in her crop.
Yeah, happy girl this morning, aren't you? Hey?
Hello.
Hey.
Hiya.
Scott's wife Zoe has arrived to take Jane back to the school.
She looks fab.
Yeah, she's doing really, really well.
So when I first see Jane, it's very obvious the difference. Her crop, although still a floppy crop, for lack of a better phrase, it's a lot better than it was. And she's looking fabulous.
The only thing, however, is that because that crop was distended, was stretched for so long, unfortunately it is a little baggy and it will remain that way. So
That's a bit rude.
it's a little bit rude. I'm sorry, honey.
So she will forever have a floppy crop.
She will. What happens now is that every time she eats, Jane's crop is going to fill up, it's going to hang over her breastbone. It means that the food won't transit through her gastrointestinal tract as it should, and unfortunately this will mean an ongoing issue for Jane. Also, you can see her posture's affected. If I provide a little bit of support, you can see she immediately stands up. So what we need to do is something that I have never done before. I have never prescribed said treatment, and it sounds like I've made it up, but I haven't. It's a crop bra. A lot of ladies that might be quite well endowed in the front department,
Right.
they need support. So what I've ended up doing is doing a little bit of sort of like, primary school craft work, where I've used one of our surgical masks and attached it then to a little bit of padding here and sort of special support of the crop just in the centre there. It feels like we're on an infomercial.
It's very lightweight, very supportive, and very attractive.
Call 0800 chicken bra.
Of all the random stories that Scotty has told me about things he's had to do to assist animals in their welfare, a chicken bra, I think, probably is the weirdest.
So that's where your crop is. So you just want to go underneath there.
Okay.
And then hold it. So what we're going to do is place one around her neck, okay? And then the other one goes underneath the wings.
Okay.
So that's just going to support that crop.
Okay.
Keep it up. Keep this girl eating and happy.
Oh my goodness.
Happy.
All those years in vet college, and this is what it's come to.
Yeah, putting a bra on a chicken. I've arrived. I'm really glad to have been able to help Jane, and even though I've given her a rather amusing bit of clothing to wear, I hope that her flock will accept her for who she is, a lovely girl that just needs a bit of support.
I now have to go and explain this to a school.
Yes.
As to why the chicken is wearing a bra.
But think of it this way, is the you have to explain it to the teachers have to explain it to the kids.
Hello, ladies. You want some?
At the school, teacher Jane Parr is waiting for Zoe to arrive with the chicken.
Hello, Mrs. Parr.
Hello.
Hello. Hello,
Zoe.
chicken.
Oh.
I have got your girl back for you.
Oh, lovely.
There's a slight alteration that I need to talk you through.
She hasn't turned into a cockerel, has she?
No, don't panic. It's not that kind of alteration. If anything, more feminine than that.
Okay.
Let me talk you through it. How am I going to explain this to Mrs. Parr, and will she take me seriously?
Hello, Jane.
But you might
Goodness.
You might notice
Something.
she has a brassiere, for lack of a different word. She basically, Scott has emptied her crop out.
Yes.
But now, because she's left with, the only way to describe it is a floppy crop.
Right.
Say it carefully.
Okay.
Floppy crop. So essentially what Scott has made her is a crop bra.
Okay.
I love the way you're taking this very seriously,
Yes.
and that's brilliant. So, it's a crop bra because once he'd managed to get all the seed, and there was actually a real mix of long grass and things like that in there, and that's what had caused the problem.
Right.
But then when her crop fills, as it would normally anyway in a chicken, it sort of fills and spills over her chest bone, as it were, and then she ends up front heavy again.
Okay.
So what the crop bra will do will keep that crop back in place, so she can then stand up properly and the food can filter down as it should.
Okay. You're going to be our only lady with a bra, aren't you, Jane? In all my days, I've never heard of a chicken with a bra. She's going to be the only chicken with a specially made lifter-upper. Oh, come on then, Jane. We're going to introduce you back to your friends.
Should we see what they make of her new apparel?
Yes.
Right, here we are, darling. Off you go.
Great to have her back. Looks like she's really happy. But a crop bra. Oh, great. So now we've got to find somewhere that can sell professionally made crop bras. Fantastic. Okay, now don't be jealous now, ladies, because we can't afford bras for all of you. Definitely not in the chicken budget.
Okay, you two, ready to go? Oh. What's that in your mouth? Come here. It's okay. Oh dear, so nervous.
Rescue dogs Nelly and Rufus have clearly fully recovered from their anaesthetics. They've been busy demolishing their bedding.
Hey? Who's the guilty party? Oh, I don't know. Hey, Inspector Clouseau, I don't need to be. Okay, come on, you two. Come on.
I can already see little glimmers of personality coming out. Certainly Rufus, he's a cheeky little chappy, ripped up his bed. And Nelly, on the other hand, she's very quiet and very graceful. She's a beautiful natured dog, and anyone is going to be incredibly lucky to own her.
Foster mum Sarah from the charity All Dogs Matter is hoping both the little dogs can now look forward to a brighter future.
I thought Rufus would be fine, but I've been quite worried about Nelly because she's had her teeth done and the spaying, so it's quite a big procedure for a little dog. And also to find out how her heart is, because we don't know how severe that might be. So that's been in the back of my mind all day.
I've got an armful of cute for you. There they are.
Oh, look at those. Hello, Nelly.
They've been perfect little patients they have. Do you want to just take one?
Just take Rufus.
You can take here. Yes, so we'll start with him because he was the first cab off the rank. So he's got his little castration wound, okay, which will heal very quickly. He's been leaving it alone. He was a little bit naughty with his bedding that was in the kennel, so a little bit of behavioural training is understandably needed for this boy. But as far as any other health treatments, he's all in the clear and very healthy.
Lovely. It's quite heartening to hear that he's being naughty and doing something that's normal and puppy-like.
Yeah.
Which he's probably never, ever done up until now.
So I think he's definitely got a mischievous streak that'll come through his personality at some point.
Yeah.
And then Nelly, beautiful girl she is.
Yeah.
So completed the spay. That went absolutely fine. Went to her mouth, 16 teeth removed. So you can see she's got a lovely kind of white teeth there in there now.
Oh, my goodness, look at that. Wow, that's better, isn't it? Goodness.
So she's done very, very well. And then last but not least, the good news keeps on coming because we completed a cardiac ultrasound. And what I could see is that, yes, she does have a valve that's a little abnormal and isn't closing properly. But in her case, we've got a perfectly functioning heart. Yes, she's got a heart murmur right now, but it won't have any impact on her future.
Fantastic. Absolutely fantastic.
So it's really, really good results.
Great, couldn't be better.
All right. So you can head off for these two.
Lovely.
And thanks for everything you do as well, and to foster these dogs when you've got your own dogs. It's a massive commitment, so thank you. And let's hope for a loving home for these two, eh?
It's incredible to work in Britain where we have so many incredible animal charities that are dedicated to the welfare of animals. And people like Sarah who open up their heart and their home to these foster animals who desperately need it. Thank God for them.
So I'll walk you to the car. It just gives me more time to give her a bit more of a cuddle.
Thank you.
Maisie. Where's he gone? Where's he gone?
And 6 weeks later...
That's a good girl. Maise. Maise. I'm gonna get you.
Scott's vet nurse Nathan couldn't be happier, with Maisie fully recovered from her cruciate surgery.
Maisie gone. Not only is she back to her old self, but she's even better. Michael did a fantastic job. She's running around, bouncing around. Her leg is better than it's ever been. Maisie means the absolute world to me. I worried so much, and now I've got a real sense of what it's like to be a client rather than the nurse. Where's he gone? 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 Oh, that's a good girl. And you?
And he's got a little brother at home as well, hasn't he?
Yeah, Captain Scott.
Captain Scott. It's a pretty cool name. Yeah, you can't really beat that, can you? Come on there, little Oreo. Let's go and have a little chat about you, shall we? Come on in the consult room. That's it. Joanna's normally a very chatty child, but she seems very quiet, very subdued. She's worried about her guinea pig. So did he make any noise when he slipped off your lap?
Yeah, kind of like a really high-pitched squeak.
Okay. Oh, that doesn't sound very good, does it? Okay, well, let's have a little look, shall we? So I'm just going to have a little feel of his back area there. Good boy. So far, so good. Not making any noise there. Hey, lad. Hey, good boy. Oh, wow. He's really passing quite a lot of poo, isn't he? Does he do this a lot at home as well?
Not this shape.
Wow. He's really going for it, isn't he? It's like raining guinea pig poo at the moment. Well, better out than in. Hey. Oh dear. So a guinea pig's leg shouldn't be able to do that. The fact that it can come out on the side like that. So I think there's something quite seriously wrong with that leg there, unfortunately. It happens all the time. So no one should feel bad. They're not like a cat that can spin around and fall beautifully on their legs. They just take the full impact on their legs. And unfortunately, I think that something has gone quite badly wrong in that leg, which is why he's cried out in pain. So what I'm going to do now is I'm going to take him downstairs. We're going to perform an X-ray. Okay. And that'll just allow us to understand exactly what's going on with that back leg.
Great. All right. Well, I really appreciate that.
Yeah.
Thank you.
Oh, boy. You're going to say bye to Mummy? Yeah?
Pix, come on. Come on, there's a good girlie. Is this all different, Pix?
In West Sussex, rescue dog Pixie is enjoying a walk with her new family before heading in to see Scott.
Right, almost at the top. Keep going.
The little pup belongs to expectant mum Katie, but it was her mum Daphne who first discovered the tough little street dog during a holiday in Italy. Daphne witnessed Pixie caught in the middle of a horrifying dog attack.
She was literally covered in blood. It was all over her face and coming up her nose, out of her mouth, and she was just screaming, really screaming. Good girl. I was nursing for 40 years, but that was one of the most awful things I think I've ever seen, really. It was... I can't describe how bad it was. It was just terrible. The eye was bulging right out of its socket, the whole eye.
The badly injured pup was immediately taken to the local vets, where she underwent life-saving emergency surgery.
Pixie wants her tummy rub.
I know, look.
She loves her tummy rub, doesn't she?
Yeah, she
loves tummy
rub.
Daphne relayed details of the shocking attack to her daughter Katie back in the UK. And when Katie saw the pictures of Pixie, her mind was made up to adopt the brave little dog.
Me and my son were looking in my emails and we both fell in love with her. And we thought, if she survived this long, she's definitely worth the fight. And we'll try and get her over here.
You're such a good girl, you are.
The family then had to raise enough funds to bring Pixie back to the UK.
The moment that she was in my arms, it was just sheer relief. She put her paws onto my shoulders and she just snuggled into my neck. I was in tears because I didn't think she was coming, and she curled up and went to sleep.
She's a lovely little dog.
But Pixie still has a tough battle ahead. The dog attack has left her with serious ongoing issues.
Both of the eyes are weeping.
Are they?
Yeah.
Oh, gosh.
We know one eye she definitely can't see out of, and we need Scott to see how much she can see out of the other eye as well. And the other problem we have is if she's in a new place, until she knows where she's going, she walks in circles and she bumps into things. When she gets discombobulated, that's what she does. Come on, Pix.
Katie is hoping Scott will be able to help her brave little rescue dog.
Although she's only been with us 5 weeks, she is a massive member of our family. Her personality shines through, and it's making sure that she is happy and healthy.
Come on, good girl.
And having seen Scott and the work he does, it's in his hands now. Pixie,
Come on, come on.
Back at the Isleworth practice.
Hey, Gina.
Scott and
Little
vet nurse
Oreo
Gina
here.
are about to x-ray guinea pig Oreo's broken leg.
What happened to you?
Problem that happens up and down the UK on a regular basis, that these little animals get hugged within an inch of their life by their usually young owners. And sadly, this guy decided to leap off little Joanna's lap has definitely injured this back leg. So you can see that's far from normal.
Yeah, yeah, I can see that. We can fix it, can't we? Can't you?
I think so. I think we can give it a good go, definitely. All right, let's go through to X-ray. All right, so let's put our little man on the table.
An old glove box is used to hold the little pet still enough for the X-ray.
Good boy.
He looks quite comfy there.
Yeah. X-ray. Oh.
Ouch.
It is very significantly broken leg. That looks like it would have hurt a lot, but he has fractured his femur. It's a break right through the middle of the thigh bone there. So we're going to need to perform surgery on this boy and try and fix his broken leg.
You've been incredibly brave, haven't you? Hey, poor lad.
Looking at this X-ray, it's very clear that Oreo has likely been in quite a significant amount of pain. Breaks right there. Oreo is safely under anaesthetic. He seems to be responding well. I can hear his lovely heartbeat in the background, which is making me feel happy. So now it's just about getting on with the job at hand.
Scott is going to need another set of hands during the delicate surgery, so vet Phoebe is called in to assist.
Hi, guys.
Hey, Phoebes.
Is this our little guinea pig?
Yes, little broken guinea pigs. I'm just trying to find the ends of the bone at the moment.
Wow, that's not just a minor break, is it?
No, it's pretty significant, isn't it? So the problem is that with the fracture occurring, the muscles have contracted. So you've got real tightening, so you've got an overlap of these bones. So what I need to do is just gently encourage them to stretch again. Okay, this is going to be tricky. Okay, so can you see there's the other piece of bone there? Okay. So what I need you to do is to hold that in place like that. So now it's a case of what we need to do. So just with that hand, let's just try and stretch the leg just to get those two pieces back into alignment.
Looks like you're getting somewhere.
It is quite tricky to try and complete a surgery like this on Oreo because his bones are really tiny and you can't see the intricate details quite as well as a larger animal. Dear, it's actually a crack.
Oh no, that's not good.
There's a crack going right up, like really far up into the femur. I don't know.
Scott has now discovered a nasty crack in the bone, and that means it's far too fragile to be pinned.
Sometimes you can see cracks on X-rays and sometimes you can't. And in this case, it's a very small animal, so this line is going to be just microscopic. So there's a fragment of bone there.
Oh.
And that is full-on shattered, unfortunately. Now that's out, there's actually a crack going right up to the knee joint. It's just not going to come together. Bugger. Full-on shattered, unfortunately. There's actually a crack going right up to the knee joint. It's just not going to come together.
At his Isleworth practice, Scott has discovered the break in guinea pig Oreo's leg is far worse than first thought.
I'll just try and put a wire around it first and just see if I can give it some stability, but I'm not holding out much hope for this.
If the nasty break can't be fixed, then the only option is amputation.
That bit of tissue I need to get out of the way, so can you just try and just here. And it's just collapsed, you know, it's just not going to work. I mean, that's just flapping in the breeze there. There's a huge amount of instability in that part of the thigh bone, and unfortunately, I'm just not going to be able to pin it back together because it's just splaying apart. Like someone's got an axe and cut it in two long ways. Unfortunately, it does mean we're going to have to amputate little Oreo's leg, which is very gutting, isn't it? Most animals do pretty well on 3 legs. Oreo doesn't have to escape from predators. He can just sit in a little girl's bedroom and be loved.
Oreo's owner, Joanna, and her dad, Jeremy, have been waiting by the phone for any news.
It's not such great news, I'm afraid. Oreo's leg is fractured and the fracture has actually got a crack in it which is going all the way down to the knee. So unfortunately, what we're going to have to do is to amputate his leg.
Well, that is, I guess, the best solution.
You know, I think that it's certainly something that we should, you know, give him the chance.
Yeah, okay, and it's just one of those things.
Okay, Jeremy, well, look, I'm going to crack on and finish this procedure and then we'll wake your boy up. I'm sorry I've had to deliver that news to you.
All the best.
Okay, cheers. Bye-bye. It's tough to call an owner mid-surgery, but in this case, unfortunately, this is the only way to go. Obviously, I'm very disappointed to be Oreo's vet and not be able to get the perfect result, which is to send him home with all 4 legs intact. But guinea pigs are very resilient little creatures, and performing the amputation doesn't mean the end of his life. It literally means the start of a new one. He will have 3 legs, but he will be out of pain. Let's wake this boy up, shall we? He's off already. Good boy. Come on, let's go. Good boy.
Oreo will sleep off the anaesthetic before heading home later today.
There you go. Mummy will be back to pick you up very soon. Yes, she will.
Come on, Pixie. Get that eye sorted out.
In St Margaret's,
Good
Katie
girl.
and 9-month-old rescue dog Pixie have arrived to see Scott.
Hello, Katie. How are
Hiya,
you? I'm
nice to
Scott.
meet you.
Nice to meet you.
Nice to meet you.
This must be Pixie.
How are you? Oh, hello. Oh, that's
Apologise.
Yes, quite over-familiar straight off the bat, isn't it? Hello. Hello.
She does love her cuddles.
Oh, even with a vet.
Ooh. I think I see what the problem might be. All right then, shall we come into the consult room?
Hey, you going to give me a cuddle?
She will,
Oh.
she will give you proper cuddles.
Little Pixie, the little scruffy fur ball. Straight away, she gives me a hug, which is just absolutely adorable. 2 fluffy paws right around my neck. Loved it. This eye, Katie, tell me all about it.
So she got attacked by 5 dogs when she was a very, very tiny puppy. And the actual eye ball came out of the socket. So it was put back in with help of my mum and the veterinary nurse, my mum.
So no, let's stop you there, Katie. Her eye popped out of her head.
Yeah.
So she got attacked by 5 dogs.
Yeah.
And then so I came
Right
popping
out,
out.
yeah.
And then your mum leapt to the rescue.
Grabbed her, put a towel over her face, and they then took her to the vets.
But you don't seem particularly traumatised by the whole thing, do you? It really makes me feel desperately sad to think that poor little Pixie at just 5 weeks of age, being set upon by 5 dogs and potentially suffering a lifelong injury. I believe she's a beautiful, special little creature that deserves a lot of love and a lot of treatment. That's exactly what I'm going to do. Let's have a little look underneath that unbelievable fringe you've got going on, haven't you? If you just hold around the shoulders for me, Katie, there. Let me have a look. I know your eyes had more attention than it ever needs, but oh my goodness. Looking at Pixie's eye, you can see, unfortunately, that it is what we call an end-stage eye. It's very small. There's a cataract that's formed within it. So unfortunately, the left eye is completely blind. Good girl. Let me have a look at this one.
No, baby.
Okay, let's see. Good girl. Does it always flick like that?
Yeah. And when she goes into somewhere that she doesn't know, she does circles, she bumps into things, and the perception isn't great. So worried about the other eye as well.
Yeah, for good reason. That is relentless flicking. Looking into the right eye, I was quite hopeful that this would be a functional, happy, healthy eye that was completely normal. Unfortunately, it isn't. So I just wouldn't mind plunging us into darkness for a second. Can you just turn the light off? So let's see. Good girl. So the back of the eye, the retina looks absolutely normal. There doesn't seem to be any issue going on with the eye. The concern I have is now 2 things. First of all, that flicking, which is called nystagmus, which does tend to indicate some sort of neurological injury, but also her pupil is only barely responsive to light. It's really upsetting and shocking to see you've got a left eye that's non-functional, and I hope that that would be my focus, but instead I'm more worried about the right eye. That's the only eye this poor little dog has left, the only eye that's functional, but unfortunately it's not functioning very well. Can we just pop her on the ground and just have a look and see what she does? I just want to see how she behaves on the floor.
Come on, Pixie.
Oh, wow.
If she's in my flat, she's fine. She knows where things are. But if it's a new environment, that's when we have the problems.
Okay. That's not normal.
No.
It's really distressing to see the clinical symptoms that little Pixie's showing. She's a young dog. She's already been through a massive trauma with her eye, and now it seems she has this neurological issue. It's very sad. My advice here is that we send you to a specialist ophthalmologist who is a vet that knows lots about eyes, and they'll have a good look at Pixie and work out what, if anything, we can do, because it may well be that eventually you're looking after a blind dog.
Yeah.
A very beautiful blind dog, however.
It was very shocking. Wasn't expecting it, but she's a fighter. She's fought this hard for this long, so at least we can move forward in the right direction.
You know, as tragic as this is, the one benefit of youth is that she just goes, well, you know, I barely remember seeing, so actually I just get on with it. I love my new family, you know, and I'm going to make the best of it.
Good.
Pixie will be given medication to help with the nausea caused by all the circling, and Scott is going to arrange the specialist appointment.
She's beautiful. Yes, you are.
In Richmond, 4-year-old French bulldog Winston is coming in with his owner Cara.
Hi, Cara.
Hi.
Hi. Hi, Winston. Hello, champ.
Winston is a popular visitor to the clinic.
There he is.
Especially with receptionist Kirsty.
How's he doing? So he's got a bit of an embarrassing problem.
Oh dear.
You might want to have a look at. It's not very nice.
Oh.
You're not looking very embarrassed, are you?
No.
Perfectly
Looking
fine.
gorgeous as always.
Yeah. All right, well, if you've got an embarrassing problem, we should probably go in private and talk about it, shouldn't we? Come on then. All right, you got him, Cara?
Yep.
That's it. Good boy.
He's kind of everything, really. He makes us laugh every day, and he's very popular, and he's very sociable and quite outgoing. And yeah, I love him to death.
So first things first, young man, embarrassing issue. I'm guessing it's the back end somewhere?
No, actually, if you get a bit closer to his face, I think you'll probably smell the problem.
Oof. Oh, my boy. Oof. Someone needs to brush his teeth. That is horrific. How long has that been going on for? Shocking breath.
It's been going on a few weeks now, and I've noticed some lumps in his mouth that's getting worse. So I just thought it'd be good to have you to have a look at it.
Yeah, okay. Can I have a little look in your mouth, my boy? Whoa. Whoa. Oh, my God, that is horrific, isn't it? Wow, it's like his whole mouth has been taken over by barnacles.
Yeah, because he's got the bulldog chops. Until we pulled them back and had a look, we just didn't realise.
And they're even on this side too. Look at that. Oh, my God.
I've never seen anything like it in my life.
Body.
When the vet says, wow, it must be pretty bad.
So basically what this is it's the papillomavirus, so the wart virus that people have.
Yep.
Dogs can get it as well. And generally, it's only 1 or 2. You know, you might get maybe 5.
Yeah.
And after a few weeks, it generally regresses, they fall off and it goes away. How long has this been going on for?
About 6 weeks.
Oh, buddy. And he's such a tough little dog, this guy, so he wouldn't give much away, but when you open his mouth, I mean, that is so unbelievable, because one of those is actually just going right between his molars, which should just be so uncomfortable. It's not that unusual for young dogs to have warts develop, and they come and then they go. But this case is extreme and incredibly unique. For a dog to have that many warts present in his mouth, it's nothing I've seen in the last 20 years. We are going to have to perform a procedure on you, my friend, to try and debulk, try and remove some of them, and then use some medications to dampen down the continued regrowth of more.
Yeah.
I think the best thing for us to do is to have him in today, give him an anaesthetic, and then harvest, if you will, these barnacles out of his mouth, and start giving him the comfort that he deserves.
Yeah, no, that's great. Thank you very much.
All right, then. Well, do you want to say goodbye to Mummy? I probably wouldn't give her a kiss, though, because with that breath, she won't thank you for it.
See you later.
Okay then, Carol. We'll give you a call once he's woken up.
Thanks very much.
All right.
Thanks, Scott.
See ya.
Cheers. Bye-bye. It's never nice. You never want your dogs to go under general anaesthetic, especially the bulldogs who can have problems with their breathing as it is. And I'm hoping that he's going to be all right. He's in good hands. And I'd be devastated if anything happened to him.
So now we're going to sort them out. Yes. We use a special bit of equipment. Yes, we are. You ready for this?
Go on. Wow. Okay.
I've just never seen anything like it.
No, I mean, I've seen one or two, yeah, but that's like a colony.
Nathan's an experienced nurse, has seen a lot, and together we've worked on many cases, but we're both quite shocked by how severe Winston's wart problem is. I am going to be removing these warts by using electrocautery, so basically a pen that cuts and then coagulates the blood at the same time. So hopefully going to be removing these warts like a hot knife through butter, but it's going to take a while.
As well as making Winston much more comfortable, the surgery will also help kickstart his immune system to fight off the wart virus.
It's actually horrible, isn't it? Gross. Poor boy. Just imagine like how many of those are in between the top and the bottom teeth. So every time he chewed, he would have been biting on his own face. What a brave soldier he's been.
The warts are coming away easily, but there are so many of them, it's going to be a slow process.
Slowly getting there, but it's unbelievable. I've never seen anything like it. Never seen anything like it.
In Richmond, Scott is treating a shocking infestation of warts inside French Bulldog Winston's mouth. While the condition is not life-threatening, it's likely at some stage Winston's immune system was weakened, allowing the warts to multiply at an alarming rate.
Let's just make sure we've completely cleared out this side. So can you put pressure on that? So you need to use your fingers to push it down halfway.
And Scott is shocked at how far the horrible growths have spread.
Some warts have gone so far down his throat, they're actually hanging into his airway. They're present in his soft palate, which is at the back of your mouth, and these warts are then going right into his larynx as a voice box. Nasty. Done. I'm really happy with that. It looks horrible now, but it will look a lot better soon. It's been a really long procedure, way longer than I thought because of just how many there were and how extensively they had spread. So he'll take a little while to recover, but actually I think he's going to feel a hell of a lot better than when he first went under. So it's a good result.
Winston will be started on medication to make sure the warts don't grow back.
I know. Oh, poor boy. Oh, no.
For now, it's time to sleep off the anaesthetic.
It's all right. I'll go and call your mummy. Good boy.
Come on then, let's go in.
In Isleworth, owner Joanna and her dad Jeremy are back to pick up guinea pig Oreo.
Hi guys. How you doing? Hello, Joanna. You all right?
Yeah.
Yeah. So Daddy's told you what's happened today, hasn't he?
Yeah.
Yeah. How are you feeling about that?
Glad he's okay.
Yeah. Well, I think you're being very brave. So I just want to warn you, okay? Obviously, he's lost his leg. All right. What you got to remember is that animals aren't hypochondriacs, so he's not going to complain to you that he doesn't have a leg. He just wants lots of love and cuddles. All right. So here he is here. Where's Mummy? There he is. So let me show him to you. There you go.
What are those metal bits?
So they're called staples, and they're going to hold the skin together. And there's lots of stitches underneath to keep it all together. And in the meantime, he needs lots of love, and he will be able to move around. He just needs to get used to walking on 3 legs rather than on 4.
Yeah, I'm really excited to get him home and just cuddle him.
The staples come out in about 10 days. See, look, you can see him moving around there already. See, you're having a little run around. That's good.
Oreo seems to be making a great recovery. He's already moving around the table, so he definitely seems to be back to his old tricks. All right then, Joanna, you give him a lovely cuddle. All right. All right, you look after your boy for me, and I'll see you very soon. All right?
What'd you say, Joanna?
Thank you.
You're very welcome.
Thank
see
you.
you later.
Thank you,
All the
Scott.
best.
All the best.
No
Cheers.
worries. Bye, guys.
I think Joanna's been very brave and said, well, you know, if he hasn't got it, then he can't feel the pain. And, that makes sense. So, yeah, we're very pleased with the outcome. Let's go. You okay?
Over in Richmond, Winston's owner Cara has also arrived to take her French bulldog home.
I'm really looking forward to seeing him, actually. Hopefully he's not going to get too excited. I don't know how sleepy he's going to be, but it'll be lovely to see him, and he's normally super excited even when I've been away for 5 minutes, so I'm sure he thinks I've left him forever.
Hello!
Hi, buddy. Hi.
So what's the first thing you notice?
The smell's gone.
Exactly.
That's for sure. My
No
God.
smell. Woke up with lovely fresh breath, didn't you?
He'll be a lot more comfortable.
Yeah, absolutely. Look, let me pass him to you.
Yeah.
Let me show you some of my handiwork. So they were absolutely surrounding, smothering the insides of his cheeks. They're under his tongue, they're on his hard palate, and then also on his soft palate. But you can see the difference.
Oh my God,
Gone.
that looks so much better. Oh, good boy.
There you can see a little bit of healing to do, of course. It was a thoroughly disgusting process, but I'm really glad all those warts have gone and he should make a full recovery and feel a lot more comfortable. Do you want to see them?
Definitely. I definitely want to see them.
They're totally disgusting.
Oh my God. Looks like something from the bottom of the ocean.
It really does. So I was thinking
it's
that looks like
horrific.
barnacles, doesn't it?
And all that in his tiny little mouth.
Yeah.
Absolutely shocked by how many were in his mouth. We knew there was quite a lot, but I'm pleased they're now in a dish and not in his mouth anymore.
All right, buddy. You sleep it off, eh? Better out than in? Yeah. All right, good boy. All right, Cara, all the best.
Thanks ever so much.
See you
Scott.
later.
Thank you. Take care. Bye-bye. Bye, Kirsty.
Pick, come on. Hey, good girl. You're going to go with Scotty today.
In West Sussex, it's now the day of Pixie's eye specialist appointment.
Good girl.
But there's been a family emergency, with owner Katie going into labour.
You scallywag.
So her mum Daphne is looking after the little dog. And Scott has stepped in to handle the specialist visit.
I know that's the farm dogs, but you don't need to bark.
Hi there, you must be Daphne.
Hi, how
Hi,
are
I'm
you?
Scott. How are you?
Hello, good morning.
Hello, Pixie. Good to see you again, beautiful.
Oh, gosh, you do recognise him, yes.
Hello, baby girl. Speaking of babies, what a drama for you this morning.
know.
So Katie's in the hospital
She's
now.
in the hospital.
About to give birth at any minute. It's been a few weeks since I've seen little Pixie, and actually she's looking a lot better. She seems very bright, very happy and enjoying life. And I feel the anti-nausea medication that I prescribed has had a real impact on improving her quality of life. But she still has some very concerning neurological symptoms. The spinning and also the eye flicking seems to have maybe even got a little worse. So I'm really looking forward to taking it to the specialist today and understanding a little bit more her problems.
Say bye to Grandma.
Bye, darling.
All right, we'll see you later, Daphne.
See you
Take
later.
care. Bye.
It's a terrific help Scott taking Pixie for her appointment, and then hopefully we'll know what to do after that.
That's a good girl. Here we go. Here we are. Let's go and see the eye doctor. Come on.
Ophthalmologist Rob Lowe is handling the consultation.
Hi there, Rob.
Hi, Scott. Lovely to meet you.
Nice to meet you as well.
Hello.
This
must be Pixie.
is your patient for the day. This is Pixie. She has quite a few fairly horrific injuries that she suffered in Italy, and unfortunately her sight is not great. So you're the man to see about that.
Well, hopefully so. Lovely. Right, if you'd like to come on through this way, we'll
Yes,
have a little
please.
look.
Great. Come on then.
Come
Let's
on
go.
then, Pixie. Good girl.
Good girl. I'm feeling a little bit of pressure right now because it is a first for me to be squiring a patient of mine through a specialist appointment, all the while the owner is trying to give birth in a hospital. So that's definitely a first for me. I just hope that I do a good job and that Pixie comes through it okay.
Let me have a little look at this eye. Well done. So just looking at hand movement towards the eye, as you appreciated, there's not much response to that hand movement, and yet she's quite capable of blinking when I touch the eyelids, which indicates that we've got a problem with the visual signal being sent up to the brain. So we're going to take a bright light and shine this into the eye now, and what we should see is a constriction of the pupil, and there should also be a blink response as well as the eye tries to protect itself from the external bright light. And we can see that there's no constriction of the pupil occurring, and there's no blink response, indicating we're lacking a basal response as well as a pupillary light reflex.
The tests done by Rob confirm Scott's suspicion that not only is Pixie blind in the damaged left eye, it appears she also has no vision in the right eye either.
Good girl.
Scott now wants to show Rob her strange circling behaviour.
It's a little like a whirling dervish. She just goes in circles, particularly when she's stressed.
So she's circulating round to the right the whole time. There's no signs of her actually being able to turn around to the left.
It would definitely suggest something more central. No, that's not just a simple eye problem.
No, there's something more going on.
Okay.
Having examined Pixie, we've found that she is unfortunately non-visual in her one remaining good eye, and we have certain signs such as the flicking of the eye from side to side and the circling, which suggests that this is a central nervous disease problem rather than a problem directly with the eye itself. Okay, little Pixie, you're going to come with me. We'll get you introduced to the anaesthetic team, get you anaesthetised and get your CT performed.
To work out what might be causing Pixie's behaviour, the little dog will now undergo a CT scan.
Great. All right. Bye, beautiful.
Yeah, well done.
All right.
Okay, we'll see you in a little bit.
See you in a bit.
Thanks very much.
Taking a CT scan gives us a 3D image of the brain and the skull.
Good girl.
The biggest concern would be is if we were to find some sort of growth, and that would be absolutely devastating. So I don't know what we're hoping for, but we're definitely hoping not to see that.
Okay, let's just slide you back a little bit.
Assisting Rob with the CT scan is Nurse Emma.
Let's get you settled.
So under the CT scan, we're looking to see if there's any skull abnormalities and any asymmetry. We're also going to be using some contrast to highlight any vascular areas within the brain which may indicate that there's a growth or something like that within the brain itself. Okay, oxygen's on.
Okay.
Okay, we're connected up.
Sending through, okay.
Okay. I just hope that this isn't going to be an ongoing deteriorating problem for her, and that's my big concern at this stage.
We're looking nice and straight there. Sending through, okay?
Okay.
In Hampshire, Pixie's undergoing a CT scan to shed some light on the damage caused by the vicious dog attack, which has left her with failing eyesight and odd circling behaviour.
How are you getting on?
Yes, well, we've got some great images through. Really, now we just need to work out what's happened. So we've had a look at the skull, and if we do a cutaway of this 3D model here, as we look at this also in cross-section, we can see here that what should be a nice, bony, hard palate running in a straight line, pretty much back to its area and then forming the base of the skull. So lots of gaps within there, and it looks like it's been displaced up towards the brain as well. And then we've also got this advancement of bony-like material into the brain cavity itself. So there are a number of processes going on here which may well start to explain why we're seeing these neurological changes with Pixie.
So it seems like this dog has been bitten and that skull has been crushed.
Yeah, that's what we're seeing. This is more of a crush injury rather than a straightforward fracture, and that's pushed bits of bone in where it shouldn't go, and that's what's probably causing these brain injuries.
Does it surprise you that she's still alive?
Not only is she alive, but she's a happy little dog.
Yeah.
And that's just testament to how well dogs cope with adversity like that. Her eyesight isn't going to get any worse because, unfortunately, there is no eyesight left anyway, so she's not going to miss that any further. And in fact, what will happen is over the next couple of months, she'll spend quite a lot of time adapting further to that loss of eyesight. And that's what Pixie has hopefully got to look forward to, is that adaptation and getting back to a semblance of her normal life.
Come on, sweetheart. Good girl. Let's see it. Oh, poor baby.
While Pixie's blindness and brain damage can't be reversed, Scott's optimistic that a care plan can be worked out with her family that will give her a good quality of life.
This little girl is such a fighter. She's woken up quickly from anaesthetic. She's no worse for wear, and considering the extent of her injuries and just how catastrophic those changes are, what a plucky, strong little girl. So proud of her. So brave. Good girl. You have a little rest, eh?
Later, Pixie has slept off the anaesthetic, and Scott is returning her to Daphne.
Who's a good boy? Who's this coming?
Hi, Daphne.
Hi.
Look who I've got.
Oh, Piggy. Picky Wicky.
Here she is.
There she is, there's a little girl. Hello. There you go, Toby. I told you she'd be back soon.
She's been such a good girl today.
She
She's
is a
really
good
done
girl.
you proud.
She's
Yeah.
a very sweet little dog.
She's not only very sweet, but incredibly brave.
Yeah.
Certainly the images that I saw today were horrific. The trauma that she sustained from that bite really was beyond unimaginable.
Really?
Yeah. But there is some good news, because the fact is, you just wouldn't believe that's the same dog that has suffered this terrible trauma. She was lucky enough that this happened early in life,
Yes.
and she has developed through it.
Yeah.
She's never known a life any different from what
Yeah.
she's living right now. The only issue that I have that we need to address with regards to your family is this. You feel that she gets worse when she's in a new environment, in a new situation.
Yeah.
I actually believe that it's anything that stresses her,
Yeah.
anything that's different, change, all those things lead to that
spinning.
repetitive
Yeah.
spinning, which
Yeah.
is not in her best interest.
No.
On the drive back from the ophthalmologist to Daphne's house, I was deep in thought. I just was really trying to work out what's the best thing for Pixie. And coming back and being in this beautiful warm room and seeing the lovely Daphne snuggled up with little Toby, I knew what the answer was.
Katie loves this dog, and I know that. But she's just about to have a new baby.
I know.
She already has children.
Yep.
And ultimately, where is the best place for this little dog? Is it with Katie and her growing family? Or is it with Grandma, who is quiet and comfortable with a loving dog beside her, sitting beside a beautiful roaring fire?
Daphne is an ex-ward sister, so she's very adept at looking after patients with complicated issues. And so I couldn't think of a more perfect owner for Pixie than that. She lives in a lovely environment. So really to have someone one-on-one focus on Pixie's best interests, I think is the perfect world for her.
She needs Toby as well for stability.
She's following Toby because she can smell Toby.
She smells Toby.
And to have a canine companion that can help her navigate this world, now we know that her vision is gone, is so important.
Yeah, I know.
And to have small children and babies and the noise and everything that comes with that, I just don't think it's the right thing for Pixie. And I think, despite how heartbreaking that might be for Katie, I actually think she wants what's best for this little dog. And I feel the best thing for Pixie is being with Grandma.
Yeah. She's going to have the best life she possibly can. We're going to take her out, show her the countryside. Oh, yeah, she's going to have a good life. Who's this baby? Who's that?
Here we go.
5 weeks after his operation, guinea pig Oreo is back with Joanna and Mum Rachel for a checkup.
Hi, Rachel. Hi, Joanne. How are you?
We've brought you Oreo back for his checkup. He's doing really well.
Yeah?
But it'd be good to know what you think.
Hello there. Now, this is the first time that I've met Captain Scott. He's quite considerably larger than his brother,
He
isn't he?
is. They started off the same. So
Nice.
it's hard to believe, really. But yes, he's thrived on us trying to get Oreo stronger.
Let's have a look. Hello, little man. How are you? It's amazing with the fur growing back. You really just can't tell that he's
No.
an animal with 3 legs.
No, and especially when he moves around, he's really good. You know, you wouldn't think he's being held back by the fact he's got 3 legs.
He's doing great. He seems very bright. So I think as far as, amputated stumps go, it looks pretty good. Joanna, are you happy?
Yes.
Yeah?
Joanna's delighted with how well Oreo's doing. I think it's better than we could have all expected. And all her friends love to come round and to see him running around and doing really well and giving him treats. So I think it's been lovely.
And is he getting around okay? Is he walking around and chasing his brother?
I think it's the other way around. His brother's chasing him.
Oh, is that right?
He can put on a real spurt of speed.
Can he?
Yes, he can.
I'm very intrigued to find out because I'm very happy with the way he's gone. And my little namesake there, yes, he's a little podgy, so he could do with some exercise.
Yes, he definitely could.
So we've actually got this guinea pig exercise track. So we thought that we'd put these guys to the test and just show that just because you've got 3 legs, you can still beat your podgy brother in a race.
Come on, Oreo. Let's see what you can do. I think it'll be really interesting because on a good day, Oreo could take captain, I think. So it'll be really good to see if he can perform today for us.
All right, well, should we put them in their little avenues.
All right.
Okay.
Come on, Captain.
Okay. How do you get them moving normally at home? How do you get them excited?
Oh, Captain, you know it, don't you?
A little bit of rustling, getting them excited. Okay, well, you keep rustling. Come on, Oreo. Get on your marks. Get set. Go. Come on, Oreo. Come on, Oreo. Look. Look.
You're a bit nervous, aren't you? What's happening?
Come on. This way. Come on. You're showing me up. Putting Captain Scott and Oreo in the guinea pig run and then releasing the beasts, they seem disinterested totally. They're barely moving, but I think it's just because they're a little bit nervous. Maybe they have a little bit of stage fright, but either way, I can see them moving a little bit, and certainly Oreo is doing really well. What's that? Oh, we're teasing him up the avenue. No cheating. Come on, good boy. Let's see you moving. Good boy. That's it. Keep coming, keep coming. I don't feel that guinea pig racing will be a spectator sport somehow.
It's a little,
yeah, a little dull.
passive.
Yeah. The fact that he's moving, really well, he seems very comfortable, seems very happy, he's eating well, so I'm a happy vet.
Yeah.
Hey, come on, your rotund brother is beating you. Come on, come on.
We've definitely got a winner.
Yay!
Oh, Oreo gets it.
Yay! My vet clinic, my rules.
Yeah.
Okay.
6 weeks later, and there's good news all round from Pixie's family.
Hannah, Pixie likes flowers.
Does she?
Katie delivered a healthy boy named Harry, and her little rescue dog Pixie is now enjoying a much quieter life with Katie's mum, Daphne.
Picky, come. Picky, come. Good girl.
Pixie's doing really well now. She's not spinning as badly as she was. She's putting on weight. She's developing into a lovely little dog, which is wonderful.
It's also Pixie's first birthday,
Well,
and
this is a
Scott has stopped
picture-perfect
by
family
to help
scene,
celebrate.
isn't it?
Hello.
Oh, hello, guys. Hello,
How are you?
Katie.
How are you?
Good. Mwah. Congratulations. Here's this little man.
This is Harry.
Hello, Harry. Aren't you gorgeous? Hi, kids. Hello, Daffers. How are you,
Hello.
darling?
I'm fine.
You
thank
all right?
you. Yeah.
Mwah. Good to see
And
you.
you.
Hello, baby.
You got-
Hello. Toby. Hello, mates. Thank you very much. And the birthday girl. Hi. Hi, 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 hi. Today is an unbelievably special day because this gorgeous little dog who's had such a harrowing existence so far has made it. It's her first birthday. Well, Mummy really does well and truly have her hands full.
Yes.
So Pixie coming to stay here with Grandma in this gorgeous environment.
It's the right decision for her, and it's the right decision for us as well. Although we do miss her, we miss her terribly, don't we, Bobby?
That's the tough thing about being a dog owner, isn't it? It's just
Yeah.
like being a parent, you have to put them first, and the best thing
Exactly.
was for her to be here.
She fits in. She's just a member of our family. Doesn't matter if she lives with me, doesn't matter if she lives with my mum. She's a member of our family, and that's all that there is to it.
All right, well, I'd like to see this little princess in motion. Hey, should we see what you like taking for a little walk? Hey,
She
a little walk? Does she? Well, let's have a look, shall we? Pixie, come. Hey, look. Well, that's awesome. Good girl. Pixie's case has been different from the usual. I haven't been able to pick up a scalpel and fix the dog. I'd say if I was walking in a park with a dog like this, I don't think people would know she was blind. Instead, this has been a case of support and of care, looking after a family and helping them through a tough time. And it's wonderful to have a day like this where we can all sit together, joyful and happy with the dogs that we love. It's very special indeed. Well, a birthday party isn't a birthday party without some presents, is it? What's in here? Look, this is for you.
Wow.
This is for you. Yeah. And this is for your little brother. There we go.
Oh,
It had to be doggy.
Yeah, no, thank you so much.
There you go.
Thank you.
There you go, little Harry. It's as big as him.
It is. There you go.
And this is for you, my little princess. There we go. Happy birthday, baby.
Here's to many